Joining us now, Shadow Health Minister Abena Oppong-Asare. Hi, good to see you. Thanks for
Morning.
taking the time to join us. Let's start with the conversation I was having with the government in the last hour. They are telling me that it is still legal for the UK to sell arms to Israel. Do you agree?
First of all, my condolences to those families of those 3 people that died for representing our country abroad. I think it's really concerning, and we really need to see the guidance, particularly that's been given, the legal advice that's been given to the Foreign Secretary. It needs to be published. So if it says that giving arms is a breach of international human rights law, then we really need to look at making sure that action is taken to suspend it if there is a breach.
And if Labour was in power, would you?
We would certainly take legal advice without a shadow of doubt.
No, of course you would. But would you publish it?
If we will take action and to make sure that we'll follow within the international rights law. That is something that the Foreign Secretary, David Lammy, has repeatedly said.
Yeah, but just to be clear, would you publish what the lawyers told you?
We would act on it. I don't see why that would be an issue in terms of transparency. It's important that all politicians know what's happening, so we'll be transparent about what's going on so that we can work collaboratively on this issue. OK.
Would the British government, if it was a Labour government, be content selling arms to Israel at the moment? Just to clarify that point.
I think before I can even answer that question, we really need to see the legal advice. If there are breaches to international human rights law and it breaches our legal convention.
But the ICJ says there has been. Others say there has been as well. 600 former legal brains and present legal brains have said they, in their opinion, we should see what has been said and that there is a breach of international law.
And we're seeing that being replicated and we're hearing people saying that there is a breach of international law, but we do need to see the legal advice that has been given to the Foreign Secretary before we can be able to answer that. And if, as I've said already, if there is a breach, then there would need to be a suspension in terms of arms.
OK, let me turn to your brief, if I may. The Telegraph this morning saying that Labour's social care plans aren't funded.
Well, first of all, I think that's incorrect. I do know that whatever we do announce, we make sure that it's fully costed. That is driven from the top, particularly from Keir to Rachel Reeves. We have a plan to make sure that we can get the NHS on the ground, particularly making sure that people can get earlier diagnosis. And one of the things that we are particularly concerned about is the fact that people are waiting a long time for appointments. But we also recognise that we have to move with the times, particularly looking at how we could use digital technology to make sure that people can have better informed decisions.
It's staggering that I know you're here today to talk about making it more accessible, digitise data.
Yeah.
But it's the 21st century. Why are we in this position?
Yeah, I mean, that's correct. You see hospitals at the moment still have pagers and fax machines. We see other aspects of society moving forward in terms of digital revolution. I know if I was to order a takeaway, I can see my driver on Lifetime where they are. But with the NHS at the moment, the technology is massively out of date, and we know that money is being wasted. So, for example, with the Red Digital Book, we've talked about.
What is that?
So that essentially, it's a digital book. It's not a digital book at the moment. It's done in a paper form, which is given to parents when their child is born. And it essentially has their weight, details about their height, and medication and illnesses. And parents are required, well, it's up to them if they take it to the doctor's appointments, which isn't always the case. The book gets lost, it gets destroyed. And what we've seen particularly is a lower uptake within the UK of parents, children being vaccinated in terms of measles.
Yeah.
And we feel that if we were to digitalise it, it would make sure that parents are informed. It would also enable...
But it must be in different parts of the country that's the case, because as far as my GP is concerned, I can have a chat with him on Zoom, I can have a Zoom appointment, I can go and collect my prescription if I needed one from the local chemist, and I never even have to see him. It's all done digitally.
It's all very patchy across the country, if I'm going to be completely honest. We have the NHS app, which a significant amount of people are signed up to, but it's not used to the best of the ability. At the moment, we're seeing, because of the fact that the digital equipment is out of date, money is being wasted in terms of doctors' time. So about equivalent to 8,000 doctors. If we were to use advanced technology, it would mean parents and individuals are better informed about their health status.
OK, the COVID app was absolutely pants and it cost us a fortune. Why should we believe that a Labour government would be any better?
Well, so with this Red Digital Book, this is something that the government had previously announced that they would implement in 2017. And there is money already aside for NHS digital moving forward, but that hasn't been implemented. And as I said, we do need to move with the times. The equipment that's being used is massively out of date.
Quarter of a century out of date.
And also conversations that I've had with health professionals, they feel massively frustrated that they don't have the relevant technology. And I just think it's massively unfair that at the current climate, people are getting patchy information in terms of their data. It depends where you live, it depends the relationship you have with your GP in terms of what data you get. And actually it takes the pressure off GPs if we had access to our data in terms of knowing what's going on.
Yeah. You probably thought I was going to ask you about Angela Rayner, but I don't think I'm going to.
I thought you were going to ask me about that.
No, I'm not going to, because I know what you're going to say. Yeah. And, you know, the story that I've read in the Mail over the weekend doesn't actually take it any further, I don't think. But tell me what you think.
So I think that Angela Rayner has answered the questions already. I just feel that this is a distraction from really talking about the issues that you've raised, particularly about
See, I knew you'd prepped for it, so I thought, you know, all of that you've...
But that's the reality of the situation.
Yeah, yes. So there was no point in you wasting all that prep time, so I thought I'd ask you, but I knew what you were going to say. Good to see you. Thanks very much indeed. Thanks a lot. Bear with me 1 second.